Hi, I'm Michelle, and my topic is on abortion. And before I say my major claim, I just want to state some facts. All of these abortion numbers are derived from the pro-abortion services courtesy of Allen Guttmacher Institute and Planned Parenthood Family Planning Perspectives. Abortion quietly destroys more than 3,000 innocent human beings a day in the U.S. only, and 130,000 a day worldwide. 52% of women obtaining abortions are younger than 25 years old. 1% of all abortions occurs because of rape, incest. 6% occurs because of potential health problems regarding the mother or the child. And 93% occurs for social reasons like you can't have the baby or you don't have enough money to support it. And also, the growing embryo has a heartbeat as early as the 21st day of conception. With that said, my major claim is abortions have a negative effect on women in society. My secondary claims are: number one, abortions have proven to cause psychological impairments to women. Abortions can cause serious physical damage to a woman's body, and abortions can cause complications in future pregnancies. For my first claim, frequently after an abortion, women suffer a range of mental and psychological problems. Guilt can control a woman's mind and heart after an abortion. And in a survey of over 100 women who suffered from post-abortion trauma, 80% expressed feelings of self-hatred, 49% reported drug abuse, 39% began to use or increase their use of alcohol, 60% reported suicidal ideation, with 28% actually attempting suicide, of which half attempted suicide twice or more times. Women often have recurrent dreams of the abortion experience, avoidance of emotional attachment, relationship problems, sleep disturbances, guilt about surviving, memory impairment, hostile outbursts, suicidal thoughts or actions, depression, and substance abuse. And these problems may occur days to years later or after the abortion. Up to 33% of aborted women develop an intense longing to become pregnant again in order to make up for the lost pregnancy. And unfortunately, many women who succeed at obtaining their replacement pregnancy discover the same problems which pressured them into having their first abortion and end up having another abortion. Women having abortions have a period of time in which they call emotional paralysis or post-abortion numbness, and it's like shell-shocked soldiers who come back for more. They're unable to express or feel their own emotions, and this appears to be greatest on patients under 17 years of age, and symptoms include self-reproach, depression, social regression, withdrawal, obsession with need to become pregnant again, and hasty marriages. My second claim is abortions can cause serious physical damage to a woman's body, and infections can happen because of the sometimes tissues left inside a woman's body. And symptoms of this: mild fever and sometimes death, and this happens anywhere from 1 in 4 to 1 in 50 women. And if there's pieces of the baby, placenta, umbilical cord, or amniotic sac in a woman's body, it may require an additional surgery to remove these remaining pieces. Women who have aborted have significantly higher rates of breast cancer also, and breast cancer has risen by 50% in America since abortion became legal in 1973. Hemorrhage can also occur, and 1 to 14% of women require blood transfusion due to bleeding from an abortion, and hepatitis can occur because of that if the blood transfusion isn't the same, or isn't the same blood type. And sepsis can occur, which is the endometrial cavity and contents become infected. And a Canadian woman actually died in a trial of medical abortion with mifepristone and misoprostol. A woman's life can be endangered if the procedure is done incorrectly. 1 out of 40 and 1 out of 400 abortions could suffer a perforated uterus or intestine. And sometimes a portion of the intestine has to be taken out because of this. and also abortion can cause complications in future pregnancies. There may be recurrent miscarriages after an abortion, and the next baby is more likely to be born prematurely with all the dangerous and costly problems that entails. Women who have two or more abortions have twice as many Women who have had two or more abortions have twice as many first trimester miscarriages and later pregnancies. After an abortion, 1 out of 20 and 1 out of 50 women become sterile. And after an abortion, it is 8 times more likely to have an ectopic pregnancy. And I just wanted to end my speech with a quote. In medical practice, there are a few surgical procedures given so little attention and so underrated in its potential hazard as abortion. It is a commonly held view that complications are inevitable by Dr. Warren, who is a world-renowned abortionist. So I hope that everybody takes these things into consideration, and yeah, thank you.
All right, you give us a minute of data that ultimately has very little to do with the claim that you're making before you finally get to that claim. When you get to the claim, I think you're a lot more focused. The secondary issues are labeled, and so that gives it a little bit more structure too. And you're making some inferences here that are controversial, so I can see that there's an argument on this point. You do need to do a better job, though, signposting on those secondary issues, because I don't think that you're consistent on that. I think a couple of spots, it just seemed like you were in that material when you got to it without telling us that we had arrived at that particular point. You have a tendency to run a lot of statistics together without stopping to explain what the statistics mean. And one of the things that's missing is we need some comparative data. So we get this number, for instance, on the third point, about the sterility or the inability to carry a pregnancy to term or ectopic pregnancies, but we have no contrast to, for instance, live births and whether or not they have a similar ratio of those kinds of problems. That's the only way that we would be able to make the inference that you're giving us. I was a little confused at one point because you have a statistic that at one point says it's either 1 in 4 or 1 in 50. Well, that's a pretty substantial difference. You know, 2% versus 25%. That sounds like there's something screwy with those statistics there, and instead of enhancing your credibility, it undermines it at that point. I think you need to talk a little bit more to the audience. You're rushing through the material, reading a lot of statistics, and what you need to do is slow down, tell us what the point is that you're trying to make, explain that idea, and then give us the evidence that shows those points instead of just trying to let the data dump make the argument for you. I think that that's a problem in the presentation. All right, thank you.